Hi, this is Dr. Sean McWilliams bringing you another video from Disc Centers of America in Alpharetta, Georgia. And today what I want to talk to you about is ice pack versus heating pad. Which one do you use? I get this question all the time, and unfortunately I find most patients choose the wrong thing. So I want to tell you which one to choose and when to use which one. So let's talk about it. You hurt your back, you sprained your knee, your neck's bothering you, what do you use? Well, most people like to go with a heating pad. And the reason they like to go with a heating pad is because a heating pad has an analgesic effect. And what's that mean? It means that it relieves or reduces pain while it's on your body, which always feels good. So that's why most patients want to go for the heating pad right away. The problem with it is that if it is within 72 hours of when you first had the injury, so if you rolled your ankle or you feel like you tweaked your back because you worked out in the yard yesterday and your back's feeling really sore, anywhere from that day to the next 2 days in a 72-hour window, you don't, and I repeat, don't want to use a heating pad. And the reason is because it's going to feel great while it's on there, and because it's relieving some pain. The heat always feels nice, but in the process of doing that, your body is taking more blood into that area because it's warming up, and your own innate intelligence in your brain says, I need to cool this area off. So it brings more blood in to help cool the area off when you're done. And a byproduct of that is that it actually makes that part of the body more swollen and stiff. That's why when a lot of patients come into my office and I ask them, what'd you do for your back? And they say, I put a heating pad on. They usually say, but man, I feel so much stiffer today. And that's a very normal response. So if it's in the first 72 hours, what I want you to do is I want you to grab an ice pack. Now, I know they don't feel quite as cozy when you go to put them on your back or another part of your body, but if it's in the first 72 hours, we want to reduce inflammatory processes or swelling, and nothing's going to do that better than good old-fashioned ice pack. Now, let's talk about ice packs for a second. Ice packs are great because they're nice and flexible, and so they can mold to your body really easily. One of the downsides of ice packs is that unless you have a really, really good ice pack, they don't keep a thing called their peak cold. Peak cold is what reduces inflammation. Now, ice is a wonderful thing, real ice, because ice keeps its peak cold until it melts. But most ice packs don't do that. So here's my tip to you is that have 2 ice packs in your freezer. I like icing an area for 30 minutes, so get it out of the freezer, put your first ice pack on whatever area you need to for 15 minutes, and then swap it out with the other one, because most ice packs will keep their peak cold for 15 minutes. So now you know for the entire 30-minute period, you've reduced inflammation. If you don't do that, it's still going to feel cool to your skin, but it's not doing anything really to reduce inflammatory processes, and that's what you're really trying to do. So, 2 ice packs, 1 for 15 minutes, swap the other one out, and I think you're going to notice a big difference. Now, also when it comes to icing, you can ice every hour. My patients come in, if they have a bad disc that's really bothering them, they're having sciatica, I'm recommending to them that they ice every single hour. This could be 7, 8, 9, 10 times a day, and it really does make a big difference. So, that's my stats and recommendations when it comes to using ice. Now, when do you use heat? Heat can be really great at times, and the times that you want to use heat is when you have a long-term chronic issue. Your back is sore all the time, and either if you're not getting care or you have a lot of arthritis in your spine or another part of the body that's longer than 72 hours, this is the guy that I usually recommend that you go to. It's going to help your muscles relax some more. Normally you're not going to bring in a bunch and create a bunch of acute inflammatory processes in your body, and it's probably going to help you be more comfortable. So when in doubt, anytime that you hurt yourself, your kids hurt themselves, or anybody in your family does, if it's in the first 72 hours, please, you want to go for ice, not heat. I think that'll help you. I think your family will feel better, or you'll feel better. And I hope this video helped you make that decision on which one to go for. please subscribe to our channel. If you have any comments, click the banner below and leave me any comments. If there's anything else that you'd like to learn about, let me know. I'm happy to do a video for you as well. And don't forget, hit the little bell sign so you get notifications every time we do a new video. Until next time, this is Dr. Sean McWilliams from Disc Centers of Alpharetta, wishing you the best in your health. And if there's anything we can do for you, please call me.